Hi, everybody. We'll get started just so I know most of you have made time either at the beginning of your day on the West Coast or with your lunch break if you're located on the East Coast like me. So my name is Adam Lombardi. I am the Director of Sales and Business Development here at Amazing Charts. I'm going to be taking you through just a quick intro on this webinar, and I'm going to be passing off to Katie Phelan, who is our practice management trainer. She'll be able to walk through many of the functions, the benefits, and some screen sharing on a short demonstration of how it would look and where you'd be working within the system. As far as the history of our practice management software, we've been working on developing this for several years as it became a hot ticket with a lot of our clients asking, are you guys going to come up with something to handle the billing? The clinical side is great, but we look for something else. In the past, most of our clients used an interface and connected to a third-party practice management of their choice. Now we have created Amazing Charts Practice Management, which has a tighter integration. It's got bidirectional flow. It'll reduce double entry. One of the things that you might know if you've ever used a third-party interface is some of the double entry that gets frustrating would be if a person's demographics changed in terms of their address or something like that. You would need to change that in two softwares. It would require logging in to two softwares and then making that change in both. With this, it's a single sign-in into Amazing Charts. A practice management tab would be available for you within your Amazing Charts clinical side. So you could click back and forth and work from one to the other. Any changes that you make in one would be recognized in real time in the other. One of the things that I want to cover, this is all part of a series that we do on billing your way, and it's basically a choice by the practice of how they want to go about conducting their business. The clinical side, obviously, we're using Amazing Charts. When it comes to the billing, if you have somebody in your staff that understands how to do medical billing, the practice management is a great option for you. It would reduce costs for you, allow you to manage your own claims and see what's going on. The thing that I want to emphasize is that it is a software and it's not a service. So you do need an end user at the other end that understands what they're doing. I realize that in a lot of offices, there might be a staff member who I think could manage it, but understand this is tied directly to your revenue. This is your payroll, this is your mortgage, this is everything that matters. So I do emphasize that you want somebody at the wheel that knows how to handle medical billing, follow-ups, and looking at any coding errors that might have been entered by just human error at the clinical side. So what you're going to get with the practice management would be eligibility checking. So real-time eligibility, which I know is a great tool for a lot of practices. When a patient comes in, you'll be able to verify the insurance that they have is active and correct. Obviously, all of us have heard the horror stories of hearing that a claim is not going to be paid because the insurance was not active, and now it becomes a collections matter of how do I get all of this money from the patient. This way, on the front end, you'd be able to see, okay, this is the correct insurance. I know that the insurance company is going to cover my claim. The customizable schedule, this is something that a lot of our clients have asked for throughout the years. The schedule in Amazing Charts Practice Management can be customizable in colors. What that gives you the benefit and the ability to do is you could either color different providers, so you could have a yellow, a blue, and a green, so at a quick glance you can tell who that person's here to see. Or you could do something based on the stage of their visit. So you could do, say, green, that they're in the waiting room, yellow, they're in the exam room, red, they're at checkout. Whatever is going to best suit your needs. The data integration, that was what I referred to earlier, that all of this information will be cross-replicated both in your practice management and in your electronic health record system. And then for clearinghouse integration, the clearinghouse that we use within Amazing Charts Practice Management is called Claim Remedy. And if you were to do research on them, they are one of the top-rated clearinghouses on the market. The way that we put that arrangement together was with our target on being top-rated and also affordable. We specialize in dealing with the smaller practices. We're not out chasing hospitals. We're looking for smaller ambulatory care, anywhere from 1 to 10 positions in an office primarily. You also will have access to the clearinghouse portal, so you'd be able to see in real time what's going on with your claim statuses. And that's one of the skills that I said you'd want to make sure somebody in your office is able to maintain. With me in a sales role, it's great to be able to project what's coming in and do forecasts. And having somebody that understands that type of mentality would definitely give you better insight into what money's coming in and what money do I have to actually proactively go after that might be leftover amounts due for a patient to pay because the insurance only covers X and so forth. So with that, I'm going to pass it along to Katie and let her walk through some of the features of Amazing Charts, practice management. I want to let all of you guys know that this demonstration and webinar is being recorded. So we will be sending out a link to all of the attendees. So you'll be able to watch this again at your leisure. Some of the things like these testimonials, we won't bore you with reading them to you, but you'll be able to get the link and you can look at all the testimonials and case studies on our website. So with that, I'm going to pass it along to Katie. If you guys do have any questions or want a customized quote, need to know anything about pricing, you can reach out to us at the sales department and we'd be glad to schedule something. We can also schedule a one-on-one personalized demonstration for any of you that would like a deeper dive. So we usually tell people to plan on around 45 minutes to an hour for one of those product demonstrations to be completed. So I'm going to pass it along to Katie. Thanks, everybody.
Thanks, Adam. So good afternoon, everyone, or maybe still morning for some of you. As Adam explained, my name is Katie Phelan. I am one of the practice management trainers here at Amazing Charts. So if any of you decide to move forward with Amazing Charts practice management, I'll probably have the pleasure of speaking with you throughout your implementation process. So today I'm going to do a high-level overview of the integration between Amazing Charts and Amazing Charts practice management. I'll also take some time and launch into our clearinghouse portal so that you can see how you'll have the advantage of managing your claims right from our clearinghouse. And all of this is being recorded, so if there are any attendees that did not have an opportunity to attend today, they'll be able to watch this at a later time. So I've gone ahead and shared my screen with everybody. You should see my screen, which is Amazing Charts. I'm going to get started in here today to talk about how the integration will work between the two systems as far as navigating and the integration with, the patient's demographics, the schedule, and of course the charges. So when you're installed with Amazing Charts Practice Management, you would still launch into Amazing Charts as you do today, but there will be access points available for the staff so that they can easily navigate over to the practice management side of the house. Amazing Charts will still store all of the patient's clinical information used for their visits, but all of the information that you would use for tracking, for billing or reporting purposes would live in Amazing Charts Practice Management. So up here at the top, you will see there's an ACPM link. If I click on that, it automatically will open the practice management. And then throughout the day, if there is a staff member that's going to need to navigate back and forth from Amazing Charts to Amazing Charts Practice Management and vice versa, down at the bottom here, you'll notice my Amazing Charts is still open, so I can very simply come down here, click back on the Amazing Charts tab, and be back into the clinical area of the product. There's actually 4 other places in Amazing Charts that I can access PM. So you would learn that, through your deep dive demo or your training. But this is probably the most obvious way that you can get into PM from AC. But we definitely take into account all of the different workflows that the staff might have. So we've put it in a few different places for you so that you can easily navigate to the practice management. All of your patients' data that currently exists in Amazing Charts, so their demographic information, their insurance information, all of that will be accessible to you in Amazing Charts Practice Management after your install. So you won't have to worry about manually converting any information over. Also, if you currently schedule appointments and manage appointments in Amazing Charts, all of those appointments will also come over into Amazing Charts Practice Management during your install process. So you won't be required to really do any kind of manual converting of information to get going on our practice management. We're able to bring all of that information over for you. And although we expect you to manage all of the patient's demographic information and scheduling information from the practice management once you are live, you would still be able to view that information in Amazing Charts, because we understand there could be nurses and medical assistants and providers that may not find it necessary to go over to the practice management to just quickly see some basic information for the patient as far as addresses and insurance information, or if they just want to quickly see who's coming in for an appointment. All of that can still be viewed in Amazing Charts. So you can see here on my schedule, all of these patients that are booked for today were booked in the practice management. But I can still see what time they're coming in, who they're going to see, any notes pertaining to their appointment. I can see all of that information right from within Amazing Charts. And if I pulled up any of the patient's demographic information in Amazing Charts, I can be assured that the information that I'm viewing is up to date, because as the front office staff updates the patient's chart in Amazing Charts Practice Management, those fields will also update in Amazing Charts. Even if you have any new patients that come into your practice and they get added into the practice management, they will also be added into Amazing Charts. And you can see right from this patient's demographics tab, there is another one of those access points I mentioned to quickly now launch Amazing Charts Practice Management from here if I wish to do so. And this one will actually bring me right into the patient's chart in Amazing Charts Practice Management. And then the last piece of the integration has to do with the billing. So when the provider is done seeing the patient in Amazing Charts and they've completed their encounter, when they go through the sign-off process, they will have the ability to code the level of the patient's visit and also select any additional CPT codes pertaining to that patient's visit. And there is a way to set up custom quick codes on the screen to mimic your paper encounter form. And after the provider selects these codes and hits the sign it, this is going to trigger Amazing Charts to take the details of the patient's visit from a charge standpoint and transmit it to Amazing Charts Practice Management for the biller to then do any review of that charge prior to transmitting it out of the system, and all of the information would then be tracked for reporting purposes in Amazing Charts Practice Management. So you can see right as I hit that Sign It in Amazing Charts how quickly you can now see in the patient's chart in Amazing Charts Practice Management that encounter. So again, the three pieces of the integration really is the patient's demographic information, the scheduling, and then of course the billing. So now let's talk about the setup of Amazing Charts Practice Management. So you'll see when I'm in Amazing Charts Practice Management, over here on the left-hand side of the screen, there are 6 different links. And the way that it was designed was to really mimic typical office workflow. So you'll notice in the front desk area of Amazing Charts Practice Management, you're going to see all of the common front desk tasks. So that's going to include searching for patients or managing your schedule. And in Amazing Charts Practice Management, you can manage the schedule 2 different ways. You can do it from the front desk, and it allows you to see at a glance the patients that are coming in for the day, the current status of their appointment, why they're coming in, who they're seeing at what location and time. And then you have the ability to take different actions on each one of these patients' appointments. You could easily launch their chart from here and either update their information or confirm their information. You can manage the details of the patient's appointment. So if you needed to add in an additional note, you could do that from here. Also, you have the ability to cancel the patient's appointment from here. You can do an on-the-spot eligibility check. Now the system does do what we call electronic automated eligibility checks for your patients that are on the schedule. But of course there are going to be circumstances where you need to do a recheck, or the patient's insurance hadn't been previously entered on their chart before their appointment. So now that it has been entered, you would want to do an on-the-spot check. You can also print an encounter form header to use, even though, because of the integration, there really is no need for paper encounter forms anymore, because the provider can do the coding right in Amazing Charts. But you can print out a header if you wish to do so. And then you can change the status of their appointments from here. So I could easily mark that a patient has now successfully been checked in. And as you select one of these statuses, this column will update accordingly. And then if an eligibility had been checked, whether it was that automated check that happens prior to their appointment or an on-the-spot check, you can see the eligibility status from here. And then you could click on any of these links to go in and get further details of that status. Find out why the patient returned a not eligible result. Or I want to now see their benefit information. What's their copay? Is a referral required? If you prefer to use more of a book application for your schedule, we have that as a second option. We call it the appointment scheduling screen. So here's where you can take advantage of that color coding customization that Adam mentioned earlier on. From here, you can see here I have color-coded my different providers columns, so I could easily know which provider schedule I'm looking at. You can color code their available slots versus their unavailable slots. I can color code appointment types. So if I wanted to mark all of my new patients purple or all my follow-up patients blue. You can color code appointment statuses. So as a patient is marked checked in, they turn green. If they're checked out, maybe they turn red. If they no-showed, they missed their appointment, maybe they turn yellow. We also have the ability to color code eligibility responses. So if eligibility is pertinent for your practice, we can set it up so that any patient that returns an eligibility response of not eligible will turn red. And one of the things that I would say I'm proud of about the most with ACPM is how easy the check-in and check-out process is. For your front desk person who has to manage the patients as they are coming in and leaving for their appointments, they can do everything right from here. They do not have to leave this screen. There are shortcuts everywhere. So if I wanted to launch a patient's chart because I needed to review their information and update it or collect and enter their copay, I can do that right from here by right-clicking on any appointment and selecting to launch their chart. And then right from their chart, it breaks down all of the different information for that patient. And the chart is pretty straightforward. It tells you up at the top of each one of the patient's panes the information that is going to be within it. And there are links within each one of the panes so that you can add and update information accordingly. You can also see when you launch a patient's chart what their copayment is. So if you needed to know what you needed to collect from the patient, when you launch the patient's chart, where their insurance information is located, you would be able to see the copay responsibility. And then right from here, you would also be able to enter in that copay responsibility. And then when you're done updating the patient's demographics at the check-in, and you X out of it, it will automatically bring you back to the schedule. And then you can just double-click back on the patient to mark that they have checked in for their appointment. You'll also notice on here, in addition to the patient chart option, you can print individual information sheets that you could hand to the patient upon check-in, and they can just review their information themselves and alert you of any changes. These patient information sheets can also be printed in bulk at the beginning of the day if you don't want to print them as the patient is coming in. You'll also notice here there is a register new patient link. So if a patient called and was a new patient, I could easily launch the registration screen and register that new patient and get them an appointment. And like many other systems, we do offer mini registrations, so you don't have to fill out the complete registration screen in order to save the patient's chart. The only required fields would be name, gender, and date of birth. And then when the patient comes in for their appointment, you would be able to get the rest of the details. And then we make it flexible for the front desk as far as booking appointments and searching for appointments. You can use different navigation options right from the appointment scheduling screen, such as the calendar over here on the right. to find availability. Or down at the bottom here, we have links that allow you to jump to different days. You also can look at a provider schedule in a multi-day view. So if you like to look at their schedule for an entire week, you can do that as well. And then for those front desk staff that want the system to do all the work for them, we also have what we call a bulk search. So you can type in a criteria up here at the top and tell the system, I want you to go out and locate an appointment between a particular date range for a particular time of day, days of the week, and the system will then return back a list for the front desk to review with the patient, whether they be on the phone or in front of them at checkout to book their next appointment. In addition to locating appointment 2 ways, you can also reschedule appointments in Amazing Charts Practice Management multiple ways. So you can either click, drag, and drop appointments to a new slot, and it brings all of the information over for you. So all you have to do is confirm that you are changing the appointment. Or you can cut and paste the appointment. So again, the front desk really never has to leave the appointment scheduling screen to do a check-in or a check-out for a patient, or even if a patient calls and is a new patient. There's also some other miscellaneous options on that front desk screen. There's a patient registration link here as well. So you can launch it from here and register a new patient. We put a couple of billing links on here because depending on the size of the practice, the front desk person may also need to perform some billing functions, manage referrals and prior authorizations for your practice, and print out a daily appointment list or those information sheets that I mentioned earlier. We also over here have the billing screen. This is where the biller goes to actually batch the claims and transmit them to the clearinghouse for forward processing. So really, once the provider does that sign-off and that visit comes over to ACPM, the biller just needs to do, or it's highly recommended that the biller does a quick review of the patient's charge prior to batching it, and that can be done right from the patient's chart. And the charge screen is all on one screen, laid out pretty straightforward for you. And after that review has been complete, they can batch those claims and transmit them in a matter of just a couple of clicks. And we do have a validation process in Amazing Charts Practice Management to make sure that your I's are dotted and your T's are crossed before the claims are actually transmitted to the clearinghouse. But then once they get to the clearinghouse, they would also be scrubbed again at the clearinghouse level. So we know the importance of trying to get the cleanest claim possible to the payer. So we do have a couple of different levels of scrubbing for your claims. So under billing, manage claim batches, that's where you would actually be able to validate and transmit those claims. The bookkeeping screen. This is where your insurance payments are going to be managed in the system. So you can see that we've really compartmentalized all of the different tasks in your practice. So if you have a front desk person that really only does front desk activities, well, they would spend the majority of their time at front desk. Your biller, well, they'll spend the majority of the time in the billing screen. And if you have someone separate doing your payment posting, they're going to spend the majority of their time in the bookkeeping screen. And we do recommend that our clients sign up for as many electronic payments as possible because it's a huge time saver. And all of those electronic payments come right into the practice management to be reviewed and auto-posted. So in a matter of just a few clicks, you'd be able to download and commit an entire ERA. So right here under the pending EOB screen, this is an example of one of those electronic payments coming in. When it comes in here, you'd be able to view the ERA detail report to see the details of the insurance payment before you manage it. And then once you download it into the system, you could review it further if necessary under our Manage Insurance EOB section. And if no further review is necessary, you'd be able to automatically commit it into the system. If you have any what we call manual insurance payments, so maybe there's a certain payer or payers that do not send electronic remittance, maybe some small workers' comp insurances. Well, those can also be entered and managed right from the bookkeeping screen as well. So you don't have to go to a separate place to manage any manual insurance payments. You'll also notice on this screen there is a section called Manage Patient and Practice Payments. This is where you can also manage all of your patient application payments, payment applications, excuse me. You could also get a general accounts receivable list here of all of your patients that have outstanding balances. And we also have the ability to do a hard close at the end of each day or each month if you want to avoid staff from entering any transactions after you've balanced. And then there's the reporting screen. So what I showed you on the bookkeeping screen is really an interactive place where you can do your insurance payment posting, manage your patient payments, see your AR. But of course, when it comes time to balance at the end of the day, whether it be your front desk needs to balance their copay drawer or the back office needs to run a payer reimbursement report, all of that is going to be in the reporting area of Amazing Charts Practice Management. And all of our reports are broken down by type. And they each have their own set of filter options that you can use to further customize the report. And most of our reports you can filter by providers. So if you're a multi-doc practice and you need to run reports by the different providers for either in order to pay them at the end of the month or just to see what is being brought in by each provider, you can do that. You can run our reports by different dates. So some of our reports are run by service date or payment date or transaction date, claim date. And you can save our reports for up to 3 months. So if you find a report that you like and you want to save it, you can do that. And when you run any of our reports in the system, the filter options that you selected when you ran the report will display on the actual report. So if you find a report that you really like, you'll know how to run it the next month or the next time that you run it. And then the administration area. Again, this is really where that customization that we were talking about earlier takes place for all of our practices. So there's a lot of different levels of customization that you can do for your practice in ACPM in addition to just color coding your schedule. We, of course, get all of our practices started with some global information. Like, for example, we automatically provision all of our practices with default payment types. But of course, if there are additional payment types that you would want to add for your practice, or you don't use certain payment types for your practice, we can customize that for you. And all of that takes place during the implementation and training portion of your onboarding with ACPM. And then statements. In ACPM, our clients can manage their statements 2 different ways. You can either send your own statements out to your patients, or if you wish, you can have our third-party vendor, BillFlash. Some of you may or may not have heard of BillFlash. They can actually send statements on your behalf. So it takes out the headache of having to print and mail all those statements on a monthly basis. So what I'd like to do now briefly is I'm going to jump over to our clearinghouse portal so you can see when you actually transmit a batch of claims out of ACPM, where those actually go for processing. And because of our relationship with our clearinghouse, we're able to provide all of our clients direct access to the clearinghouse portal so that you can go in and see your status of your claims after you transmitted them out of Amazing Charts Practice Management. And you can even, follow that claim status all the way through the adjudication. So any users in your practice that would want access to the portal will get their own separate logins. So here's our clearinghouse portal. There are links along the top here for navigation purposes, but where I am right now is the claim file screen. So these claim batches have been transmitted out of one or multiple test environments in Amazing Charts Practice Management. So you'd be able to launch in here and confirm that your claim batch had been in fact forwarded to the payer. And you'd be able to see right away if all of the claims within that batch were then forwarded to the payer for further processing. So some other systems, you have to wait to get a report back from the clearinghouse. It can be up to 48 hours after you transmitted a batch to find out whether or not your claims are actually forwarded to the payer. With us, you can log into the clearinghouse portal within minutes of transmitting a batch and be able to confirm whether or not they were forwarded to the payer. And of course, if they weren't forwarded to the payer for one reason or another, you would be able to work your errors and get those claims successfully forwarded to the payer, right from either within the portal, or of course you can always make any edits in Amazing Charts Practice Management. Some of our clients like being able to correct the claim at the portal level, so we give you that option. Practices prefer to go back to the source, which would be practice management, and make the corrections there. So again, we give you a couple of different workflow options for whatever is going to work best for your practice. And then even after your claims are forwarded to the payer, you will get payer acknowledgement reports, and those payer acknowledgement reports, again, can be viewed either from within the portal, or you can view them right within the practice management. Because the clearinghouse has to actually send the claims to the payer and then send the reports back to ACPM, all that information gets stored in the portal for you, so that if you wanted to access it from here during your billing follow-up, you could do that, or if you prefer to view your response reports from the practice management, you can do that. Same thing with your ERAs. So your electronic remittances will automatically come into Amazing Charts Practice Management, but because our clearinghouse portal is kind of the middleman in everything, you can access them from the clearinghouse as well. You also can see other claim status. So when the claim is forwarded to the payer, you could also come in here and see further statuses. Of course, I'm in a training environment, so I can't actually see all the other types of statuses that you would see. But in addition, where it says in the column forwarded to payer, if the payer accepted a claim, I would see that updated status here. If it rejected, I would see that status here. If it was adjudicated and it was on an ERA, I would actually have a hyperlink right to the ERA from here, and I could drill in and see the adjudication details for that individual patient. So you'll always know the status of your claims, whether it be from Amazing Charts Practice Management, viewing the response reports, or getting your ERAs, or taking advantage of, the different options that you have right within our clearinghouse portal to see your claim status. And there's also additional reports available to our clients in the clearinghouse portal. So usually if you can't find the report you're looking for in Amazing Charts Practice Management, you can find it within the portal. So there's a lot of added benefits of having that direct access to our clearinghouse. And you will be assigned a clearinghouse representative at the beginning of the implementation, and the representative would actually help you throughout the process of getting your claims, your payer set up for claim submission and electronic payments. So that is our demonstration for today. I do want to now open up the floor for any questions that you may have from today's demonstration. Of course, this was just a very high-level overview. So if you have a lot of questions that are specific to your practice, whether it be workflow related or billing scenarios, please by all means reach out to us and we can schedule a deep dive demo with our demo specialist.
Assuming everybody's near a pen and paper, I'll give you my direct contact in case you ever want to reach out to me or the sales department. Direct phone number is 866-382-5932. My extension is 3364. And my email is alombardi, BARDI@amazingcharts.com.
Let me take a look. We do have some questions that have come through. So someone was wondering about the speed. So how the speed will be if they were to integrate with Amazing Charts Practice Management. So it all depends. So practice management is internet-based. So if your internet speed is slow in your office, we typically recommend that you upgrade your internet speed prior to going on the practice management so that obviously when you're navigating around the system, saving information, loading screens, that there's no delay. If you're currently on the cloud with Amazing Charts and it seems to work fine, you should have no problem with Amazing Charts Practice Management. We do send out what we call an implementation packet when clients first show interest and sign on with ACPM. That would give you our recommended specs that your computer would need to have as far as internet goes, internet and anything else that would be required in order to run practice management successfully to make sure that you are ready to use it. So a few people asked about the reports. They'd like to see some more of the reports. Sure. That's not a problem. So if I go into the reporting area of Amazing Charts Practice Management and I pull what we consider a deposit slip report, that would be a report that we use for the front desk to balance their copay drawer at the end of the day. This report allows you to split up your cash, check, and credit card payments, and it will also provide the responsible party that made the payment so that, at the end of the day, you can make sure that everything balances. The balance before closing report, this is more for an overall report to balance your total charges, payments, and adjustments for the day. And when you run this report, you have the option on whether to include details. So another nice thing about our reports is you can either run a lot of the reports by summary, so it gives you just a very basic information, or if you want to see patient details and charge details, you can choose to do that as well. So you'll see this report also breaks down by patient and gives you the description of the charge payment and adjustment along, of course, with grand totals. Here's one of those summary reports. You can run it over a span of time so you can see how your charges and AR have changed over the course of a few months on the system. And if you like to see information broken down by insurance plan or by carrier, here's one of those reports that I can run to see by the different carriers in my practice, my total charges, payments, and adjustments over a period of time. And this is the carrier level. You can also drill down your reports to the plan level. So those are a few more of the different report options that we have available. So it looks like that was all of the questions that came through. If there are no other questions, we will close the presentation for today. But again, if you do have any questions after today, maybe when you see the recorded version or after you've gone back and discussed things with the others in your practice, please don't hesitate to reach out to us. All right. Well, thank you again, everyone. I do appreciate you all taking the time out today to join us. I hope you found this useful. and I hope everyone has a wonderful rest of the afternoon.
Thanks, everybody.